Hello and welcome to my video presentation. In this discussion, I will review a clinical scenario involving a patient experiencing a suicidal crisis in the context of major depressive disorder. I will describe the patient presentation, assess the level of suicide risk, and discuss appropriate evidence-based interventions to ensure patient safety. In this scenario, I'm evaluating a 45-year-old male patient that I have been treating in an outpatient psychiatric setting for approximately 6 months. The patient has a history of major depressive disorder that has been well managed with citalopram, also known as Celexa, at a dose of 20 milligrams daily. He also previously struggled with pornography addiction that had created problems in his marriage, although he now reports that he addressed this through therapy and has not engaged in that behavior for several years. During today's visit, the patient presents visibly distressed. He reports that he recently discovered that his wife had been cheating on him for 2 years. He states that he came home from work and found that his wife had taken their children and left a note explaining the infidelity. Divorce proceedings are now underway. The patient reports feeling devastated and overwhelmed. He states that he has had difficulty functioning and has been calling out of work repeatedly. He also reports that he has been drinking at least a 6-pack of beer each night since the separation. When asked directly about suicidal ideation, the patient reports that he has been experiencing suicidal thoughts since his wife left. When asked if he has considered how he might harm himself, he states that he has thought about shooting himself. When asked what has prevented him from acting on this plan, he explains that his children are the only reason he has not acted on these thoughts, although he says he is beginning to lose hope that he will ever see them again. At this point in the encounter, I would pause and I would conduct a comprehensive suicide risk assessment. Suicide risk assessment involves evaluating suicidal ideation, intent, plan, access to lethal means, substance use, psychosocial stressors, and protective factors. In this case, several high-risk factors are present. The patient reports active suicidal ideation and has identified a specific method involving a firearm. The presence of a plan and access to a lethal means significantly all increase the risk for suicide. In addition, the patient reports increased alcohol consumption. Alcohol is clinically important here because it lowers inhibition and increases impulsivity, which may increase the likelihood that this patient will act on the suicidal thoughts. The patient is also experiencing several major psychosocial stressors, including marital betrayal, separation from his children, and possible job loss. Although he identifies his children as a protective factor, his statement that he is losing hope suggests that this protective factor may be weakening. According to the Diagnostic Statistical Manual of Mental Disorders, 5th edition, text revision, suicidal ideation accompanied by intent and access to lethal means represents a high-risk clinical situation requiring immediate intervention. At this point, patient safety becomes the immediate clinical priority. Because the patient has active suicidal ideation and a specific plan involving a firearm, outpatient management alone would not be safe for him. The first step would be ensuring that the patient remains in the clinic and is not left alone while additional evaluation occurs. I will also assess whether the patient currently has access to the firearm and determine whether the weapon could be temporarily secured or removed by a trusted individual. The standard of care in this situation is to arrange an immediate psychiatric evaluation and hospitalization in order to ensure patient safety and allow for close monitoring and stabilization. If the patient agrees to voluntary hospitalization, arrangements would be made for safe transport to the emergency department or inpatient psychiatric facility. If the patient refuses hospitalization but continues to present a danger to himself, Involuntary commitment procedures may be necessary under state mental health laws. While coordinating emergency care, it is important to maintain a supportive and empathetic approach. I would acknowledge the patient's emotional pain and reinforce that help is available. For example, I might say something like this: "You have been through a very painful and unexpected situation. It is understandable that you feel overwhelmed right now. My main concern is your safety, and I want to make sure that we get you the support you need." Managing psychiatric crisis often requires a multidisciplinary approach involving psychiatrists, emergency physicians, social workers, and crisis intervention teams to ensure the patient receives comprehensive care. In summary, this patient presents with multiple high-risk indicators for suicide, including active suicidal ideation, a specific plan involving a firearm, alcohol misuse, and significant psychosocial stressors. Immediate intervention is required to ensure patient safety and arrange appropriate psychiatric treatment. This case highlights the importance of early identification of suicide risk and timely intervention to ensure patient safety. As psychiatric providers, it is essential that we carefully assess risk factors, protective factors, and access to lethal means in order to make appropriate clinical decisions that protect our patients during times of crisis. Thanks so much for watching this presentation.